As you may know, 25 to 30% of overall medical costs are actually unnecessary and avoidable. If you were to break down a typical health plan's costs, they'd look something like this. Approximately half of these avoidable costs are due to physician and hospital overuse, abuse, misuse and incompetency, while the other half can be classified as avoidable drug-impacted medical costs, such as unnecessary ER visits, hospital admissions and readmissions, and rapid patient movement due to higher risk bands. These costs are due to adverse drug events, duplicate therapies, poor adherence, absence of personalized care plan-driven vital sign monitoring, lack of actionable intelligence-driven timely care coordination, and missing social connection for those patients who are depressed, lonely, and without family support. Today, health plans, PBMs and physicians are completely neglecting this unmanaged portion of managed care. This presents an immense opportunity for quality of care improvements that can provide cost savings for all stakeholders. Introducing nirvanaAccountableCare from RxAdvance, the comprehensive chronic care risk management program that focuses on the unmanaged portion of managed care. nirvanaAccountableCare enables collaboration amongst care continuum stakeholders to transform costs into shared savings for all parties: the payer, provider, patient, and RxAdvance. nirvanaAccountableCare is a total care delivery model that reduces avoidable drug-impacted medical costs in 6 steps. Risk stratification using advanced clinical clusters, comprehensive medication review and personalized care plan derivation, smart adherence management, smart home care plan management, smart home care delivery management, and risk and shared savings management. RxAdvance's proprietary algorithm integrates the medical, pharmacy and lab data of all health plan members and then distributes these patients into 5 distinct risk bands. High-risk patients are identified as nirvanaAccountableCare eligible. Next, when an eligible member visits her primary care physician, RxAdvance alerts the physician within his or her workflow that there's an opportunity to improve the patient's health through nirvanaAccountableCare services. This alert also identifies the reward for the physician for enrolling the patient in nirvanaAccountableCare services. The member and physician agree upon a personal medication list and customized smart care plan that will optimize both savings and patient health through the elimination of duplicate therapies and adverse drug events. As you can see here, in the case of Mrs. Schultz, the number of medications have been reduced from 13 to 9 to reduce adverse effects and improve overall quality of life. Following which, patients are educated about nirvanaAccountableCare. nirvanaAccountableCare services include Nirvana Smart, a total care delivery model. Nirvana Smart provides medication adherence management, Bluetooth-enabled vital sign monitoring through provided devices, weekly delivery of pre-filled disposable pill trays, and a platform that coordinates all individuals and information vital to the patient's health and well-being. Following enrollment and education, the patient is contacted by an RxAdvance care advisor, who's responsible for coordinating the deployment of Nirvana Smart to the patient's home through a designated field installation professional. Once set up in the home, Nirvana Smart will notify the patient of when it's time to take his or her medication with voice alerts.
Mrs. Schultz, please take your morning medication.
All these medications are neatly packaged in an electronic disposable pill tray, providing convenience to patients and ensuring that the correct medications are taken at the appropriate time of day.
Mrs. Schultz, please record your blood pressure.
Nirvana Smart will further remind the patient to capture vital sign measurements and to schedule timely primary care visits to capture HEDIS measures.
Your blood pressure has been recorded. Thank you. Your blood pressure is out of range. After relaxing for 5 minutes, please take your reading again. Your blood pressure has been recorded. Thank you. Your blood pressure is out of range. Your care coordinator will contact you shortly.
The member's designated care coordinator will receive an out-of-range vital measurement alert. After getting consent from the member, the care coordinator will inform the member that an RX Advance physician will visit her to tend to her needs.
Mrs. Scholes, Dr. Smith has accepted your request for a home visit. Dr. Smith is on the way. He will arrive at your home in 20 minutes.
Before the RX Advance physician arrives, he'll review the member's information, current complaints, member vitals, visit history, current clinical status, past clinical status, medication optimization, gaps in care, continuity of care measures, as well as possible appropriate diagnoses either on a smartphone or tablet. The physician will then examine the member to address any immediate complaints and concerns, and will also perform any comprehensive gaps in care and continuity of care measures due for the member. The physician can also take this opportunity to educate the member about potential out-of-pocket savings by switching to approved generic alternatives. Through Nirvana Smart, any changes in clinical condition, medications, and other care coordination activities performed by the visiting doctor will be updated in the member's medical record. This information is then shared with all stakeholders across the care continuum, including family members, caregivers, physicians, and health plan case managers, to ensure uninterrupted member care. The truly comprehensive care coordination services provided by nirvanaAccountableCare will lead to a substantial reduction in avoidable drug-impacted medical costs. The resulting cost savings will be shared amongst all stakeholders: the health plan, primary care physician, patient, RX Advance, and Nirvana Accountable Care administration cost. Never in the past has a single entity taken the accountability to reduce avoidable drug-impacted medical costs throughout the care continuum, nor share the rewards with all stakeholders. Nirvana Accountable Care from RX Advance. Managing comprehensively the most unmanaged portion of managed care through risk sharing.